It depends on how neurotic your pediatrician or family practice is. I think probably at least checking it once or twice a year is a good thing. I honestly can say, I can't recall, well, I can't say that. I have one kid that's about 260, he's about 5'6", so he's 260 pounds. He has some blood pressure issues and he's on a stimulant. I think his weight contributes. Blood pressure, for me, just being 3 points, 4 points higher is enough for me. I'm not looking for, I'm not saying he has 170 over 110. He might have 125 over 85, but I don't like that. I prefer it to be lower. But blood pressure is not likely. Tics. When I was a pediatrician 25 years ago, we thought medicine caused tics. Okay, let me tell you the most common scenario. We'd see Johnny when he was 5, we put him on Ritalin. When he was 7 or 8, he would develop a tic. We always blame the Ritalin. Okay? The truth is, I do have some patients, if I give them a stimulant, tics get worse. I have some patients, if I give them a stimulant, tics get better. But for the vast majority of kids, tics come and go with time. They're worse with stress. They're worse with lack of sleep. So often they're worse during the summer. They're often worse during Christmas, when kids are staying up later and sort of getting disconnected. If I have kids in high school, it's worse during finals. It's worse in college during finals also. So tics are usually worse with stress, lack of sleep. There's a small subgroup of kids that can have something called PANDAS. PANDAS is called Pediatric Autoimmune Neuropsych Disorder Associated with Strep. What does that mean? In English, when you and I were kids, some kids had scarlet fever. Scarlet fever would be a rash and we blame strep. But it really was not the strep, it's the strep antibody that caused the rash. Rarely it can affect the heart. That causes rheumatic heart disease. Again, it's not the strep that does it, it's the body's antibody. Well, in children with PANDAS, what happens is the antibody, we believe, attacks the brain and causes increased tics, increased irritability, sometimes increased obsessions. The wonderful thing if your child has PANDAS is an antibiotic often helps it. So your child doesn't need to be on an antipsychotic, they don't need to be on an antidepressant. Frequently the antibiotic helps. So tics, generally we feel they're not caused by stimulants. Bipolar disorder. If I use a high dose of medicine, it's possible that a child with ADD symptoms can look bipolar. But the truth of the matter is I don't generally feel that the bipolar is caused by the stimulant. I think that for some children, if we use a high dose, we may take the cover off of the bipolar. I think bipolar is frequently overdiagnosed, okay? 25 years ago, we rarely made the diagnosis, and now Dr. Popoulos wrote a book about 4 or 5 years ago. He's a child psychiatrist out of New York, and now everyone's labeled bipolar. Sometimes kids have moods because they're unhappy. Sometimes kids truly have bipolar, but I see a lot of rage reaction if kids are truly unhappy. So kids where mom and dad have had difficult times, or daddy was deployed, or grandma died and she was a primary caretaker, worse yet, a child's been physically or sexually abused, those kids can look bipolar. So everything that screams and yells and tantrums is not bipolar. Stimulants, do they work? Generally, if we try A, B, and C, we can find one that helps your Johnny. So the stimulants can help. What are the troubles with the stimulants, even if they last 12 hours? The problem is they last 12 hours. So if you give Johnny medicine at 7 and it's Focalin, it might be in the body by 7:30. If it's Concerta, it may be in the body by 9. If it's Vyvanse, it might take an hour to get in. So each medicine starts to be effective at a different time. So sometimes parents might be giving the right medicine, but they've already failed the first class because they gave it right before the first class and the medicine's not kicking in until the second class. So understanding how your child functions and how he or she attends is important. I don't love stimulants, but I appreciate them. And what I mean by, if I could help, if every child can have a wife, a medical assistant, and a physician assistant that keep them out of trouble, then life could probably survive. If we had someone in school who took our notes while we were goofing off, that might help. But the truth is, ADD by itself is really hard. So I think medicines are not evil, but they're a I believe in most cases they're a necessary tool. But I want to emphasize it's just one tool. The wonderful news, the reason why I love my job, is I have kids who come in often who are failing, often who are causing much havoc and destruction in their home. And after we get things under control, things generally get better. Kids' self-esteem improves. Mom and dads are happier, and things are moving in the right direction. I've had kids failing in middle school and high school who we put them on a stimulant and their D's and F's go to A's and B's. So we really see some pretty remarkable things, but medicine is never the answer, it's just a tool. So sometimes my parents think if I give Johnny medicine, it's enough. No, it's probably going to take a lot of work from mom and dad to help him with structure and clear commands and good eye contact. The two other medicines, and then I'm going to try to answer questions. Strattera came out back in early 2000. Strattera, I'm not anti-drug companies, but Lilly didn't tell us. Lilly made Strattera. Lilly was trying to develop an antidepressant. So Strattera was like the old-fashioned Pamelor, or you might have heard Tofranil for bedwetting. So it was really an antidepressant. They obviously used a different word. They called it Strattera, but it was what they call a tricyclic antidepressant. But they spent millions trying to develop Strattera, and it didn't work for depression. But what they found was if they compared it to sugar pills, placebo, that it had some benefit for ADD symptoms. And that's probably true. The trouble is if you give Strattera, most children still can't focus and pay attention. So most of us don't use Strattera. Now, if your child's on it and he's doing well, don't stop. But maybe it's helping anxiety, or maybe your child just needs a little bit of a bump. Most recent medicine that came out is a medicine called Intuniv. I failed to mention two other medicines that you might have seen or heard. Clonidine and Tenex are blood pressure medicines. And I'll come back to Intuniv, they're connected. Clonidine is a blood pressure medicine. If your child's not sleeping, your pediatrician might have used it to help sleep. It helps reduce impulsivity, hyperactivity, but sometimes it puts your child out. So they're not hyper, but they're sort of like sleeping in the class. So Clonidine was not a favorite. Tenex, which is like a sister compound, it's also a blood pressure medicine. It worked, but it only seemed to work for a little bit, 3-4 hours. So if you're going to take Tenex, most kids were taking it in the morning, at noon, at 4, and at 8. And if you have an ADD parent, it's hard enough to give medicines once or twice a day. So in fairness, Tenex is a decent medicine, but it didn't work the way it was. Intuniv, we thought it was a lot more hocus pocus from the pharmaceutical companies. But Intuniv is a new compound that came out. It's long-acting Tenex. And what we're finding is it seems to really help. Now, right now, most of the kids I've added Tenex to, the Intuniv to, were kids who were already on a stimulant. So the vast majority, we added the Intuniv to the Focalin, or we added the Intuniv to the Concerta. And what we find is that they're having an easier time in the morning before the medicine kicks in, and they're having an easier time in the evening after the medicine kicks in. And some of our families are saying on the weekend they don't even give the stimulant, they just keep the Intuniv. But it's not a stimulant. It's one of those stimulants I have to give you a hard copy every time. Intuniv is just like, I don't want to say amoxicillin, but it's just an antibiotic that I can call in on the phone. I don't want to suggest that it's safer. I think all medicines have potential benefits and potential, drawbacks. But I think it's an easier medicine for a doctor to write. But I think it's been exciting. The trouble is it's only been 3 months. We see a lot of positive. I don't know if it's ever going to replace the stimulants, but I know for my adult children, with the hours that they work, I said, guys, if it's hard to see your doc, sometimes you might want to talk to your doc about this Intuniv because it's something that he or she can call in, and it seems to have some efficacy. With regards to the stimulants, I have loved each of them at different moments. And what I mean by that is when Concerta came out, I thought it was the best thing since sliced water. And then Focalin XR, I thought it was the next best thing. And each medicine has helped some portion of our population. But if your daughter does well with Focalin, your son may do well with Concerta, and your child may do great with Vyvanse. It doesn't mean that Vyvanse is better. It just means that some kids respond better to the Ritalin products, some kids do better with the Adderall products, and then there's some kids that respond to both. And then every once in a while, it's a real challenge. I have a child that I've tried A, B, and C, and nothing works. And that's always a dilemma for me. Where would I like to go from here? One, I probably have demonstrated my ADD a little bit because my wife says you have to sort of know where you're going, and half the time I don't tell people where I'm going when I speak. But ADD is really a dance. It's truly a disorder. It causes dysfunction in the child, in the home, in the school, and in our community. The bad news is medicine alone will never fix it. If you just give Ritalin to a child, it will never fix it. Your child may pay attention, he or she may focus, but all the other stuff that happens will probably continue to happen. So we see that often, that children